Well, joining me in the studio is the chair of the British Trauma All Parliamentary Group. That is Rosie Duffield, who joins us now. Rosie, very good evening to you. And, you know, you watch that report, you read what Baroness Amos has come up with, and I mean, to say it's shocking is almost to downplay it. It's incredible almost.
Yeah, I mean, I wish I was shocked, but I've read so many reports like this and individual hospital trust reports and the report that we did as the Birth Trauma All Party Group. And it's great that Sky are covering it because I think a lot of people don't know the extent to which this is a problem across the country.
And when you say across the country, what I think also comes out today is it does, and this is a problem, isn't it? It varies quite a lot.
Absolutely.
Depending on where you are. And obviously most people don't have a choice around these things. So it is a bit of a, to use that terrible cliche, a postcode lottery. Yeah,
and that was one of the top findings of our report when we did it. We had 40 recommendations. One of them was to end the postcode lottery. And I can imagine with Jonathan being in the studio exactly the kinds of things he'd be saying if he was still the shadow Health Secretary, and all of these things. We just want them to stop. We want, you know, the reports are great and I really like Baroness Amos, but we just need some action there.
Well, that's my point, and, you know, this seems to be a running theme tonight of, you know, yet more reports they're going to report at some point in the future. Whereas what you, others and campaigners want is action. I mean, why have we not seen that or that already?
I think one of the problems is the system. I think people out there who just think, why can't we solve this? I've been an MP for 8.5 years. I've had 8 health secretaries. So what happens is that someone takes up the mantle. Victoria Atkins, who was the last government health secretary, was really keen on our report and wanted to carry through the majority of the recommendations, and then there was an election called, and I just assumed actually that Jonathan would kind of go straight into the job, or, you know, someone similar, maybe Wes Streeting, and that we would just get on with it. But I guess the reality in government isn't that straightforward.
Is there also, just briefly on this, like also an ingrained cultural problem here, though, that's a kind of goes beyond even what recommendations can be implemented?
Yeah, I think there's so many different problems, and one of the things that Baroness Amos is highlighting is the racial element to it. So there's women not being believed, but women of, you know, colour being believed even less.
And working class women as well.
Yeah, absolutely. It's people, you know, I see the kind of people that come to see me are the people that have a voice, are usually fairly middle class and sort of capable of speaking to an MP or brave enough to speak to an MP. If you've got all kinds of other issues in your life, it's much harder to do that.
OK, well, let's bring in Jonathan and Andrew, who are with me in the studio. And, of course, you know, as Rosie was saying, you were the Shadow Health Secretary.
For a long time, yeah.
You know, here we are yet again, talking about people who want to see things change.
Yeah, you know, you said we're talking about reports tonight. We're talking about something even more fundamental than that. It is, again, an example of women, often vulnerable women, often working class women, women from colour, of colour, being denied, their concerns being dismissed by the system, and it often having the most devastating of consequences. And by the way, look, there are problems in the NHS. Often it stems from quite a paternalistic attitude. The individuals who work in the NHS do not think of themselves as bad people, and they are not bad people. But again, the system as a whole is failing, and it's always failing women. I mean, it's not just these stories are devastating, but there are all kinds of examples across our National Health Service of how the NHS does not take women's health concerns as seriously as they ought to, that women are often dismissed. I mean, how many times do you hear a story of a woman in pain and discomfort going to the GP time and time? You think there's something wrong with her. The GP keep dismissing it, and it turns out it's some horrendous cancer of some sort. There is an issue, and it's got to be sorted.
But the problem is, Andrew, I mean, how can it be sorted? Yes. Because, you know, as I say, I mean, you can change systems.
I mean, can I talk from my personal experience as well? Because it's always a starting point, isn't it? I mean, I had a really difficult pregnancy. I was coughing up blood clots. I nearly lost a child very early on. And I was seen as a geriatric mum, having him at 43, as you are as you get older. But the GP wasn't listening to my concerns. But when I ended up in A&E one time, it was actually the instinct of one of the doctors there says, something's not right. I'm going to send you for a heart scan. And they discovered a left bundle branch block. And so then the care was amazing. But to get to that stage was very difficult. And I think you're right, actually, Jonathan. I think it's a system. Yeah, it is very paternalistic. But I think, look, not everybody is angels. We get good and bad, whatever industry, and I used to chair the patient safety All Party Group, and one of the stats when I was chairing it was 650 people per month die with mistakes in the NHS, and which was horrific. This was going back, 2015, 2016. It might be worse, it might be better now. But I think it is, you know your own body, don't you? And you know changes in your relatives. I mean, like, if I can just give a quick example, when my mum had she'd had an operation to remove, my late mum, a benign tumour on the brain. And when I saw her, they said she hadn't woke up from the anaesthetic, but she'd been talking to me. And they didn't believe me. Wow. And I said, look, she's got an infection. My dad died of MRSA. She's got an infection. Oh, she's got something not right. They wouldn't listen to me. And then within 10 hours, she died of sepsis. Yeah, and the thing is, family, they've got to start listening to families more. I went into politics because of mistakes in the NHS when my dad died.
And, this is all very difficult. And it's also all very personal. And you say the stories we've been hearing tonight. Yeah. Rosie, the question is, though, in the end, this is an interim report. I mean, you want action to happen now. I mean, this report's due to deliver, we're told, in the spring of next year. Are you confident it's going to actually deliver change?
I really hope so, but I'd rather that Baroness Amos got the time to dig as deeply as she needs to do, and she's going to start taking evidence from people in about January, February, and I have full faith in her. But if I was a patient now and I was pregnant, I'd be really worried about this. And I think the key finding, if we don't listen to anything else, it's literally that, listen to women. We've got to do that more.
And there plays a consequence. If there's somebody in the system, within the system, who's failing women or patients, they need to be called out and dealt with.
But there's something, something that could be done right now. Yeah. And it's this atrocious situation where if you've lost your baby, you're returned to the same labour ward alongside women who are there with their newborn babies. How does that make somebody feel? And you would have thought that's something
that could be changed.
That could be changed now.
Okay. Rosie, we really appreciate your time. Thank you very much indeed. Rosie Duffield there joining us in the studio.